Hello, I'm Dr Ellie Cannon. I'm a GP and I'm going to be talking to you today about coronavirus. Coronavirus is actually a very common group of viruses that often cause respiratory infections like coughs and colds. We probably have all had a coronavirus at some point in our life because they're the typical type of coughs and colds that we all will have had through the winter. The difference with this new coronavirus, or COVID-19, is that it is a brand new type of coronavirus, and we've never seen it before in humans until the end of 2019 when the first cases appeared. That makes it concerning because that means that nobody around the world has got any sort of immunity to it, which means any of us can get the virus. We're all susceptible, which means it can spread as it already has started to. Coronavirus is spread through what we call respiratory droplets. If somebody has the infection and then coughs or sneezes, those respiratory droplets can be passed on to the people around them in close contact. The respiratory droplets can also be passed on to surfaces which are then touched by other people, and the virus spreads. The most common symptom that we've seen so far is a fever, a dry cough, and shortness of breath. What we also know is that the majority of people who get coronavirus will actually have a mild illness, and that even includes groups of people who are considered vulnerable, like the elderly and those people with underlying conditions. The best defense against coronavirus when you're out of the home is washing your hands. We know that good hand hygiene, using soap and water for 20 seconds, is enough to get rid of the virus from your hands. Social distancing is a phrase I think we're going to hear a lot over the next few weeks, and basically it means reducing your contact with other people. Social distancing can be anything from working from home, to not shaking somebody's hands, to not kissing them when you say hello. From the data so far, we don't know how long this new coronavirus lasts on surfaces, but from other coronaviruses, what we know is they can last anything from a few hours up to actually a few days. The only way to get rid of that is to clean and disinfect surfaces, particularly those areas that are touched very frequently, for example, light switches, taps, and remote controls. Cleaning removes the visible dirt from your surfaces, and disinfectants kill the bacteria and the viruses, as long as you're following the instructions to use them in the most effective way. It's important for us all to remember that the majority of people who get coronavirus will have a mild illness. We shouldn't be worrying about it, but we should be taking action, as we know that hand washing and surface hygiene are our best defense against it. As we know, this is an evolving situation with coronavirus, so for the most up-to-date advice, make sure you are following the guidance from Public Health England. I hope you found today's information useful with me, Dr Ellie Cannon. We can all play our part in preventing the spread of coronavirus. Thank you.